In part 2 of chapter 15, we're going to continue with extremity injuries and start by looking at splinters. Usually it's a small puncture wound and you may or may not see the splinter. You can use tweezers to remove it and clean with soap and water. If it's impaled under the nail, you have to cut a V-shaped notch in the nail and remove the splinter with tweezers. With blood under the nail, you might have excruciating pain and it won't disappear until the blood is drained. You can immerse the finger in ice, water, or apply ice, elevate the hand, and apply dressing. Ring strangulation can occur when the ring has become too tight on a finger, and it can come after an injury that causes swelling. So you might want to lubricate the finger, put an ice pack on it, massage it, and wind thread around the finger. There could be severe pain and swelling with hip dislocations. And, if that occurs, you can see that there might be a visible injury. Their hip is flexed and the knees bent and rotated inward towards the opposite hip. So hip dislocations can be very severe pain and swelling. Assess and treat for shock, stabilize the injury, check for an ankle pulse, and seek medical care. Look for pain in the groin area, inability to lift the leg, and the leg may appear shortened. So for a hip fracture, you can treat for shock, stabilize the leg, monitor the ankle pulse, and seek medical care. With the femur, the bone of the upper leg and the thigh, you can look for a severe pain if there's a fracture. There might be deformity, swelling, or pop or snap. You need to assess and treat for shock, cover the wound, stabilize the injured leg, monitor the ankle pulse, and seek medical care. With muscle contusions, you need to find out where it is. Maybe the person was receiving a direct hit to a certain muscle area. There'll be swelling, pain, tightness, and bruising. You can follow the Rice procedure, apply ice for 20 minutes, 3 to 4 times a day for 48 hours, and stretch the muscle. With muscle strain, there might be a popping or pulling sensation while running or jogging. There's tenderness, stiffness, swelling, and maybe bruising. Follow the Rice procedure and stretch the muscles. For knee injuries, this is one of the most serious joint injuries. Medical care is required, especially if the knee was hit or twisted. A knee fracture, you might see a dislocation or deformity, tenderness, and swelling. When you have a knee fracture, if a pulse can be felt in the ankle with no deformity, splint the leg with the knee straight. If a pulse can be felt in the ankle with significant deformity, splint the knee in a position that you're found and seek medical care. With a knee dislocation, there could be excruciating pain, deformity, and absence of pulse. Stabilize the knee, seek immediate medical care. Patellar dislocation, a blow or twist causing a kneecap to move outside of the knee joint. There could be swelling, inability to bend or straighten the knee, pain and deformity. Use the Rice procedure. Do not try to relocate. Splint the knee in the position that it's found in and seek medical care. With a knee sprain, there's pain, popping or snapping, locking sensation, inability to walk without limping, can't bend or straighten, swelling and bruising can occur. Follow the Rice procedure and seek medical care. With a knee contusion, it's usually a direct blow to the kneecap. The person has pain, swelling, tenderness, and black and blue. Best thing to do is follow the Rice procedure. Lower leg injuries can occur at any place between the knee and the ankle. There's a deformity when bones are broken. If only one bone is broken, then the little deformity may be present. The tibia and fibula fractures, a direct blow or twisting force can produce severe pain, swelling, deformity, and tenderness. Stabilize the leg, apply ice, and seek medical care. With the tibia and fibula contusions, a person may have received a direct hit on the shin, tenderness when touched, sharp pain, discoloration, difficulty moving the ankle up and down, and numbness may occur in the toes or foot. Tibia and fibula contusion, what should you do? Expose the injury, apply the Rice procedure, and if numbness continues, seek medical care. Muscle cramps. That can occur during intense exercise sessions, painful contractions, and it actually disables the person. Gently stretch it, apply pressure to relax muscle, apply ice, drink salt water, and or commercial sports drink. With shin splints, there's aches that subsides after an activity stops, and ache that is a result of an increase in the workout routine. This chronic condition can get worse. Apply ice, apply pressure, apply ice before and after the activity, and try not to do as much activity until the pain is gone. You can take anti-inflammatory pain medicines as well. With the foot and ankle injury, there can be pain or popping, swelling, tenderness, wherever the injury is when pressed. Immediately you should take your shoes off, apply the Rice procedure. If there's question about the severity of the injury, splint and seek medical care. For toe injuries, look for pain and swelling and deformity. Treat the same as you would a finger injury. And, just remember with all of these injuries, there are specific ways to treat, and sometimes it's hard to remember all of these. So you want to keep reviewing, go over your text, and see what the procedures are for each of the injuries in the upper and lower extremities. And again, trying to do some type of practicing, pretending using a person as your subject, and try and practice what to do in an emergency situation will help you when an emergency actually does occur. So again, just a brief outline, review your textbook and any other materials in this week's learning module.